I've noticed something in my years as a clinician that doesn't make the headlines. The men who thrive after 60 aren't necessarily the ones with the perfect genes. They're the men who caught 3 tiny, silent self-care mistakes before those mistakes became permanent roadblocks to their independence. I'm Dr. Christine Rodriguez, and welcome to Men's Vitality Hub. If you've been feeling a bit more exhausted lately, or if you've noticed your confidence slipping because of little issues you're too embarrassed to bring up with your GP, you are in exactly the right place. Most health advice for men our age is either too clinical or, frankly, a bit insulting. But today, we're having a private clinic session. We're going to expose 3 specific habits that are quietly sabotaging your neurological health, your sleep, and your dignity. And here is the micro cliffhanger. One of these mistakes is something you likely do every single morning thinking you're being healthy, but it's actually the reason you're waking up 4 times a night. Let's get straight to the why. You see, after 60, your body's operating system updates, but most of us are still trying to run the 30-year-old version of the software. Your kidneys, your bladder, and even your skin cells change how they process the world. If you don't adjust your daily maintenance, the hardware starts to wear down. I've spent over a decade helping men navigate these shifts, and I can tell you that fixing these 3 errors isn't about pampering yourself. It's about tactical preservation. It's about making sure you're the one deciding when to leave the party, not your bladder. The 3rd mistake on our list is one I see every single day: drinking water the wrong way. I know, it sounds simple. Dr. Christine, I just tilt the glass back, right? Not exactly. When you were 30, your kidneys were high-efficiency filters. Now, they're a bit more like a classic car. They still get the job done, but they need a specific rhythm. Many men make the mistake of backloading their hydration. They're busy all day, forget to drink, and then chug 3 glasses of water after dinner to catch up. Biologically, this is a disaster. Your kidneys become less efficient at concentrating urine at night as you age. When you flood the system at 8 p.m., you're essentially scheduling a 2 a.m. wake-up call. This leads to a cascade of exhaustion. Interrupted sleep isn't just annoying. It raises your cortisol, messes with your blood pressure, and drains your brain of the focus you need the next day. Imagine your bladder is a balloon that has lost a bit of its stretch over the years. If you irritate it with highly concentrated urine because you were dehydrated all morning, or you overstretch it right before bed, you're triggering urgency signals that don't need to be there. The fix? Front load. Aim to get 70% of your fluids in before 2 p.m. Think of it like fueling a plane for a long flight. You do it before takeoff, not mid-air. Mistake number 2 is something almost no man talks about: ignoring your pelvic floor. For years, we've been told this is a women's issue. That misinformation is robbing men of their quality of life. Your pelvic floor is a hammock of muscle that supports your bladder, your bowel, and yes, your intimate function. After 60, these muscles naturally lose tone through a process called sarcopenia, age-related muscle wasting. When that hammock sags, you get the dreaded dribble. You think you're finished at the restroom. You walk away, and 30 seconds later, you're reaching for a change of clothes. Still with me? That shows you're serious about your vitality. This leakage isn't a sign of old age. It's a sign of an untrained muscle. You wouldn't expect to lift a heavy box with weak biceps, so why expect your bladder to stay closed with a weak pelvic floor? The medical why is simple. The external urinary sphincter relies on these muscles to stay clamped. If the muscle is weak, the clamp fails. The relief comes in the form of tactical Kegels. You can do them while driving, watching the news, or even reading this. Find that muscle you'd use to stop yourself from passing gas. Squeeze it for 5 seconds, and release. 3 sets of 10, every day. Within 8 weeks, most of my patients report a night and day difference in their control and their confidence. Now we come to the most important one, the mistake that causes the most silent suffering: neglecting post-bathroom hygiene. This is where we have to be direct, man to man, doctor to patient. Most of us were taught the shake-and-go method in grade school. But after 60, your skin becomes thinner. It loses its lipid barrier. Urine is acidic. When small amounts stay trapped against thin, sensitive skin, it triggers perineal dermatitis. It starts as a slight itch, then a rash, and eventually, it can lead to a fungal infection or skin breakdown that makes walking painful. I remember a patient, let's call him Frank. He was 68 and had stopped going on his daily walks because the chafing was too much. He thought he was just getting old and sensitive. In reality, he just needed to update his hygiene. I told him to switch to unscented, alcohol-free wipes and to focus on blotting rather than wiping. When you wipe roughly, you're creating micro tears in that thin skin. Blotting preserves the skin's integrity. We also switched him to breathable cotton boxes to allow airflow. 2 weeks later, Frank was back on the trail. He didn't have a skin condition. He had a hygiene gap. Fixing these 3 things, your hydration timing, your pelvic strength, and your hygiene, creates what I call the dignity shield. It protects you from the small embarrassments that cause men to withdraw from life. You've spent decades taking care of everyone else. Your family, your career, your community. You've earned the right to feel comfortable in your own skin. Don't let these invisible mistakes steal the vitality you've worked so hard to maintain. Before you go, I want you to remember that your body is a high-performance machine. It just needs a different grade of fuel and a different maintenance schedule than it did 20 years ago. If this helped you feel a little less alone and a lot more empowered, please hit that like button. It helps this message reach other men who might be suffering in silence. Join our community at Men's Vitality Hub by subscribing so you never miss these honest, science-backed updates. Self-care isn't an indulgence, it's a tactical necessity for independence. Small changes in habit lead to massive shifts in vitality. I've got a question for the comments today. Which of these 3 mistakes caught you by surprise, and are you willing to try the front-loading hydration challenge for the next 7 days? I'll be down there answering your questions. I'm Dr. Christine Rodriguez, and remember, you aren't just aging, you're evolving. Take care of yourself.